Premature ovarian insufficiency is where the ovaries kind of stop working before the traditional menopausal route. So these are for women whose ovaries aren't making any more estrogen before the age of 40. Most of the time, this is just something spontaneous that happens, meaning idiopathic. We don't really find a reason for it. But other reasons, it could be something genetic, could be a medication exposure, it could be from a surgery or a trauma event. And so navigating why it happened and how we can help keep that person healthy and safe now, as well as make decisions about their reproductive future, which could involve, donor egg pregnancies or donor embryo or adoption or foster or, anything that would help them meet their goals and navigating this unexpected and complex time for people. Premature ovarian insufficiency, or POI, is diagnosed from a series of labs. It's based on your history. It's not having a period when you come off of any hormone for 12 months. We also get some labs to confirm that your brain is working really hard to talk to your ovaries and your ovaries just aren't responding. So it's a really high stimulating hormone from your brain and a low estrogen level from your ovaries. Amenorrhea, or not having a period, can mean a series of different things. It's either that your ovaries have lots of eggs and they're not talking to your brain well, or your ovaries don't have any eggs and so therefore aren't listening to your brain. And so diagnosing this difference between these things can be a little bit complex, certainly at home if you're reading up on the internet. So what we do is we do a thorough investigation, physical exam, history, and imaging and blood work. Come in, we talk about what's going on, we draw some blood, and we do an ultrasound, and that's really helpful. In PCOS, we should see quite a few eggs in the ovaries, which we can actually see. We actually see via follicles that are little egg houses, but surrogates for eggs. And then for women who have premature ovarian insufficiency, usually there's, difference in histories between the two, but we also can use imaging and blood work to differentiate between these things. Donor egg pregnancies or donor embryo pregnancies are something I feel really passionate about. I think it's a wonderful option for people who have premature ovarian insufficiency or have their ovaries out or have a genetic condition that's not going to work with them and their partner to have a biologic child. This is where eggs are created, donated by someone who goes through IVF themselves to stimulate those eggs, and then they're frozen in time, usually someone in their early 20s. And so those can be used to be fertilized with your partner's sperm or any sperm that you choose, and then you can carry that pregnancy. The embryo gets made, it gets placed inside of your uterus. And so not only are you their mother in all ways that are meaningful, you tuck the kid in at night, you feed them their dinners, you read them bedtime stories, but quite literally when you're carrying the pregnancy, you're exchanging blood with that baby and impacting the expression of their DNA. It's called epigenetic changes. I think it is so amazing that although the baseline DNA, that egg didn't come from you, there are still genetic and emotional and familial ways to impact the outcomes of that child and build your family in a way that's really beautiful.